They have their finger on the pulse of what the state is doing from a healthcare standpoint.
It is a likened to, I think, a think tank for Arkansas.
ACHI is a nimble center that translates data into information to have an impact.
We're a change agent.
Well, I was there before the beginning. In the early 90s, we wrote a report which at the time almost got me fired from the university about the state of the health of Arkansas. And it wasn't great.
I was part of that first team that came on, and we really were there to try to get the rationale behind the serious health problems that we suffered in this state. So a lot of what we did in the beginning years was really getting that information together so that we could present it in viable arguments about what was needed, where it was needed, and who needed it.
And that's how ACHI got started.
I think we met in the parking lot of the VA hospital. They said there was this thing called the tobacco settlement which was going to happen.
The tobacco settlement came from the tobacco manufacturers agreeing that they had caused harm in states, and so it was a blood money payoff. And we wanted to make sure that all of that money went for health programs. And we continue to this day to be the only state that secured all of the tobacco settlement money for health programs in perpetuity for the state.
That was very key to ACHI's establishment and the credibility that it now has.
The Clean Indoor Air Bill was a real achievement. We were early in the nation to actually declare indoor public spaces free of tobacco smoke. It was a secondhand exposure that we knew caused harm. And we passed through the legislature the Clean Indoor Air Act, which actually required all public spaces to be free from tobacco use.
I think of ACHI and its leadership as thinking, like, how do we actually make something happen?
The trauma system is an organized system across the state to get people to the most efficacious location for their nature of their trauma to get the best possible care that's available. Arkansas was the only state in the United States that did not have a trauma system.
We're at our core a policy shop, but we use all the tools that are available to us to make change happen and to inspire others to make change happen, because we can't do it alone.
So as a result of getting that network together, we've seen a marked decrease in death from trauma in this state. About 2/3 of the individuals who had preventable deaths have survived as a result of this trauma system. So that was an exciting time and a big, I think, accomplishment for ACHI.
The issues that most resonate with me is our involvement with the implementation of the Affordable Care Act.
With the Medicaid expansion through the private option, that's broad-based change. That affected nearly 300,000 Arkansans' lives.
It was one of those moments that ACHI was front and center on.
What ACHI really brought to it was kind of the research behind the scenes that said, here's why this makes a difference for Arkansans if we actually expand Medicaid. They actually helped with some of the legislative drafting. And really, most importantly, I think Joe and some of his team members really helped us kind of think through the strategy. Had it not been for ACHI, I don't know that they would have happened.
COVID hit all of us in an unexpected way, and our center was uniquely positioned with data, with the ability to translate information and provide it to local decision makers so that they understood this new threat.
There's really only one place to look at first to get answers, and that's to go to ACHI.
We really reached out and broadened ACHI's visibility and awareness of what we were about, to be first, right, credible, and helpful to decision makers that were making difficult decisions as we face this new and unknown threat.
The trust level that we had, combined with the science and the health information that ACHI had, was a perfect marriage, and it allowed for the membership to feel good about asking whatever question they felt was important, and trusting that the answer they got back was real. And I think that partnership made a huge difference in lowering numbers and keeping people healthy.
The future of health and healthcare in Arkansas and in our nation are going to be full of both opportunities and challenges. We want to continue to be a trusted source of information to help translate the complexity into understandable opportunities for people to make better decisions. That requires data, that requires analyses, and that requires understanding of how our healthcare system is evolving.
You know, we've always looked to them as a single source of truth around data for providers, data around our payers that we have, data around other forms of insurance companies that are out of our state, being able to help guide us because they are able to see across the state, and what impacts us in Northwest Arkansas may or may not be the same thing that impacts someone in Central Arkansas or the Delta region. And so they're able to bring all of that together through these resources and these different pillars so that we're all working together towards a healthier Arkansas.
We've really developed a lot of that trust with our partners to be able to collect and maintain data. And on top of that, to be able to add some analytic capability, visualization capability, which, you know, we're used to making the data speak and inspiring action, but now we can actually make the data sing.
It's just a great organization. Yeah, I treasure for Arkansas.
I think we've made a difference in the health and the health care opportunities in Arkansas. And with each new success, you get a little more ingrained, a little more rooted in trying to make a difference. And we try to make a difference each and every day.